My name is Dr. Jennifer Belisle. I'm a family medicine physician at Osceola Medical Center. So a day in my life in clinic is different every day. So right now I practice clinical medicine and obstetrics. And so usually we see patients in clinic from morning till afternoon. In family medicine, we see all kinds of patients, from babies to middle age to adulthood and into like elderly ages. I have a couple of patients even approaching a century. So every day is a little different. There's usually a potpourri of complaints or concerns or just preventive visits. And then scattered in between that, we do, because I do obstetrics, we see patients for deliveries. We run down the hall and deliver babies. We come in the middle of the night sometimes. Sometimes they don't need to be born yet, so they call and have questions, so we do triage and answer questions back and forth. And sometimes we're just monitoring really high-risk pregnancies with extra testing, so back and forth phone calls between OB. We have this amazing system called a medical record, so we get messages back and forth in labs, and so in between visits we're answering those questions and sending labs back to patients. So usually it's pretty nonstop. There's never a dull moment. I chose being a physician back in 8th grade, just sort of this really strong curiosity about science and how the body works and how we can integrate wellness into our daily life, and just those interactions that we can have with people to share that understanding and knowledge. Especially as I got further along, it's just really interesting to be able to learn those things and then share it with other people so they can incorporate that into their life, because not everybody wants to learn about their body or health. And so just being passionate about those interactions that we can have with people. I'm pretty passionate about obstetrics just because it's a really unique time of life that we can help patients transition to. I mean, we all learn from our own birth stories. I had 3 children, and so each of those deliveries and pregnancies was a little bit different, and so we learn from that and want to share that. I love taking care of newborns and helping moms make the transition. I think there's something really interesting and fun about like middle age, where we just sort of have all these things and we can try to prevent bad things from happening and set up our bodies and ourselves for a healthy like retirement years and sort of later in life. And then I think there's also some really amazing things about the later decades of life, like the 80s and the 90s, that we can focus on what they've accomplished in their life and what sort of quality of life they want to have for the remaining years that they happen to be on Earth. Osceola Medical Center is a really, really special place. So a lot of us that practice here have come and never left because we were drawn to our partners here, because we all sort of practice a like-minded kind of medicine. It's a really small facility, but it gives this whole breadth of care. So from clinical medicine to infusion center to emergency care to inpatient care to obstetrics to surgery to even like a nursing home that's attached. So just this whole spectrum, all within one facility, just down a hallway. And the really cool thing is, because it's small, you can just make a phone call and say, I really need this for my patient, and people will stop what they're doing and make that happen. So just that small connectedness. There's this individualized care between all of your care team members. So whether it's a specialist or a family medicine doctor or your nurses or the assistants at room people, they look at you as a person, not just a number. So we have patients that drive hours to come to our facility just because we get that small town personal touch with really, really excellent level of care though. I'm excited to meet you and take care of your family.